Reason number 46 to get a Nissan. Features, especially the ones you get with the 2025 Nissan Kicks Play. Integrated Apple CarPlay, a spacious interior, advanced safety features, and more room in your budget. Because it's the most affordable new vehicle in Quebec. Get the 2025 Nissan Kicks Play S from only $22,774, including a $2,600 cash purchase bonus. Visit your Nissan dealer today. Until March 2nd, conditions apply. Details at Nissan.
Back on the Elias Makos Show. Welcome back. Justine McIntyre here, sitting in for Elias Makos. I mentioned earlier a Taylor Swift contest, and I just want to mention that today is the last day to enter. We had some questions coming in about that. So it's the iHeartRadio 13 Days of Taylor Swift contest. Today, I guess, is day 13. So you can see the details at cjd800.com. All right. Some important news here. This is something that, ladies, it's important to stay up on this. If you're in the age category that I'm in, early 50s, you probably have been receiving those reminder letters to go and get your checkup for breast cancer. Breast Cancer Canada has released a report detailing the state of breast cancer care in Canada, and it's the first report of its kind for this organization, taking evidence from patients, experts, and the public. And in the overview, it identified some urgent gaps in care and treatment delays in Canada. Very concerning. Found that breast cancer diagnoses among women in their 20s, as young as in their 20s, 30s, 40s, and early 50s are on the rise. And the report emphasizes the need for earlier screening for those who are at average risk. So you may not think that you are at risk. Get the screening done anyway. The report finds that Canada falls behind other G7 countries in terms of timely access to breast cancer treatment. Speaking with us about this report is Kimberly Carson. She's the CEO of Breast Cancer Canada. Welcome to the show, Kimberly.
Good morning. Thank you very much for having me.
It's my pleasure. So first of all, I want to talk with you about this report. Is there anything that surprised you in terms of the findings of this report?
You know, not a surprise, but I think when you put it all together, I think that becomes the surprise. We're obviously very passionate about advocating for breast cancer in Canada, and we want to make sure that we're getting timely access to treatment and that patients are being screened and that breast cancer, if it's there, is caught as early as possible.
Mm-hmm. I mean, I was a bit surprised to hear that Canada is behind other G7 countries in terms of timely access to treatment.
Yeah, unfortunately, it's the time for approval of medications and et cetera through our complicated process. And we're certainly imploring government agencies to take a look at how quickly we're getting timely access to medications. It can take up to 2 years, as you can see from our report, to have that medication available to patients in Canada, which can be life-changing.
Now, of course, the earlier the earlier the cancer is detected, the better, and the earlier they have access to treatment, then the better the outcome, correct?
Correct. Absolutely.
Yeah. So what kind of impact is this having then on patient outcomes, the fact that we're seeing delays in breast cancer treatment and care?
We used to think that there was 3 different types of breast cancer, and now we know there's more than 50. And now the treatments are very targeted to each one of those types of breast cancer. So having access to that treatment that's specific for your breast cancer extends your life and your quality of life for quite a bit of time. So we're really advocating for any patients that need that medication for long-term life. Our metastatic breast cancer patients now are living 10, 15, 20 years, but they do need access to those medications.
Okay, and what the fact that this is the first time that there is a report of this kind detailing sort of the state of the care and treatment that's available in Canada, what are some of the recommendations or what do you see coming out of this report?
We're imploring provinces, even though the National Task Force has not lowered the screening age to 40, because we're seeing the data that says breast cancer is occurring at an earlier age. We're imploring provinces to go ahead and lower the screening age to 40, and some have already done that. We're imploring the government of Quebec to do so, and I know they're looking at it. We know that the sooner we catch it, the better the outcomes, the less invasive the treatment. So really looking at how do we actually catch it as early as possible, so we're not looking at, metastatic breast cancer by the time it's actually being diagnosed. So that's going to be one of our huge recommendations, to please lower that screening age to 40 so that we catch it earlier and, treat it with a, less intensive treatment, and actually, quite frankly, much more cost beneficial to the whole system.
Well, I would expect that that's what they're going to be looking at also, is the cost of providing screening at a younger age versus, outcome in terms of the treatment that's necessary once it's found. Because we know that these screening programs do have a cost to them. I mean, when you're sending personalized letters out and having women show up and get the screening done, there's got to be a substantial cost to that.
Yeah, certainly, but certainly the cost of catching a breast cancer diagnosis at a later stage outweighs the cost of the screening. And there's a number of studies that are already available to prove that, and there's a number of studies already available that cite that per province. So, certainly the cost of a mammogram is by far much less than, the cost of an expensive treatment for, let's say, a patient that's already presenting with metastatic.
Mm-hmm, for sure. And what about shortening treatment wait times? What do you think can be done there?
We're imploring the system itself to take a look at how, and we're starting to provide some recommendations sitting around task force and advisory committees to say that there are some options for Canada to improve their timely access to treatment. We have a 6-month recommendation, which again is already too long compared to some other G7 countries, and we're not even hitting that. So, we're imploring those governing bodies to take a look at how other countries are doing it and how perhaps we can pick up some of their best practices to increase that shorter timeline, if that makes sense.
Mm-hmm. That absolutely makes sense. Well, something that I think we all need to take a little bit more seriously, make sure that I think maybe one of the factors might be access to family doctors, because I know that in Quebec, that's definitely an issue. People not having access to a family doctor, so not necessarily getting those regular checkups that are needed. And that can also help, even in the absence of a screening test, just having that regular checkup and having the doctor do a manual check can be helpful as well.
Yeah, absolutely. And we implore people to actually know their own breast health. If they notice any changes, to certainly get in there, even if it means having to present at Emerge. And, have the emergency department do the screening if they're under the age of 50 in the province of Quebec. But certainly if they do have a primary caregiver and they notice a change, that they should get to that primary caregiver as soon as possible. And the primary caregiver can still recommend a mammogram under the age of 50 if it's referred by them. What we're asking for all provinces, and Ontario has just done this as of October the 8th, is that women have access to self-referred screening at the age of 40, so that they don't need a family caregiver to get access to screening at the age of 40.
Good recommendation. We've been speaking with Kimberly Carson, CEO of Breast Cancer Canada. Thanks for coming on the show, Kimberly.
Absolutely. Anytime. Thank you.
All right. Pleasure.